Hi, everyone, and thanks
Hey
for attending.
everyone. Hey Rich, welcome to
Uh,
the yeah, we were talking today. We had a lot at the same time. Fantastic. We're so happy to have you here. This is session 11 of the COVID-19 the Orthopedic Response, our virtual summit brought to you by the Digital Orthopedics Conference San Francisco, with the joining us is the American Academy of Orthopedic Surgery, and of course the support of the Department of Orthopedic Surgery at University of California, San Francisco. So in this session, we're going into physical therapy. There'll be two companies that will be telling us how they're managing patients virtually on the internet and what they've learned in the process. We brought you two companies, both of which have been doing this for a long time with a tremendous amount of experience. Rich's company that you'll be hearing about presently is based in Europe, and the Force Therapeutics that follows is actually based on the East Coast of the United States. But we're very excited to have you, Rich. Rich, you have a tremendous experience in the space. You 30 years as a clinical therapist, building platforms and outpatient orthopedic rehabilitation centers. Is that right?
That's correct. Yeah. 30 years frontline.
And then you started working with the Joint Academy, and tell us a little bit about that, and then tell us how we can think about using this technology in the context of patients who are at home who may have arthritis and pain.
It's actually a funny story how I collided with Joint Academy. So I was a clinical physical therapist trying to build orthopedic programs, specifically towards big need areas. So the two biggest needs seem to be hip and knee problems and low back problems. So I started clinical programs to address those. So very structured clinical programs. I was taking that out and trying to get referrals into my program. Stumbled across an insurance company saying, hey, this is a really good program. Would you like to use it? And they said, yeah, but how are we going to get everybody into your clinic? And I had an aha moment saying, yeah, that's right. I'm probably going to have to be able to find a way to deliver this to a wider audience. So I started looking into my own technologies to develop to get it out to a wider audience, and sold it to that one insurance company and started to run with this program. And then that same company came to me and said, hey, we found a company in Sweden that's 5 years ahead of you with technology. They've been doing this for a long time. And I said, really, give me their number. I'm going to give them a call. And they called their CEO and said, I work for you now. And so that's how I started working with the Joint Academy about 2.5 years ago.
That's exciting. So I just got a note to myself that I should speak slower. So I'm going to enjoin you to do the same, because you, like me, are passionate about this topic and get a little bit ahead of ourselves. So I'm going to turn this over to you and look forward to your presentation.
Great. Well, and thank you very much for inviting me to participate in this. It's my third DOCSF. And I remember my first one thinking, oh, this is a digital orthopedic conference. And it's kind of exciting that I get to present a digital orthopedic program, and that program is for chronic joint pain, called Joint Academy. So it wasn't always a digital program. It actually started in Sweden. Leif Dahlberg was an orthopedic surgeon. First half of his 30-year career, he spent frontline orthopedic surgeon doing procedures and trying to work primarily with chronic joint problems. Halfway through, he switched and became a professor and more of a researcher. And so he spent the second half of his career trying to figure out, looking for that silver bullet, looking for the solution that would solve chronic joint problems. And so through the course of his 15 years of research, and I've heard Leif talk, he talks about, he was looking for injections or pills or surgeries or growing cartilage. He was looking for that secret sauce that would allow him to solve chronic joint problems. What he stumbled across was it's probably exercise that seems to enhance the health of the joint the most. So in 2009, he credentialed 800 clinics, and over 1,000 physical therapists were trained to deliver a very structured clinical program in Sweden. And that program included coaching by a physical therapist, rehabilitative restorative exercises, education for shared decision-making, peer-to-peer support. They were able to get about 200,000 Swedish citizens to go to one of those 800 facilities and participate in the program. And then Leif did a research paper on 22,000 of those patients. And the question was, is this an effective way at managing patients that have chronic joint problems? And the outcomes of that research was, yeah, it's a very effective first line of defense for people that have chronic joint problems. Some of the outcomes they found clinically was a significant reduction in pain scores, significant improvement in physical function. People stopped taking medication. So I think half of the people that went through the program were no longer taking pain medication or anti-inflammatory medication. And they realized in Sweden that that lowered some of the downstream utilization and costs. Interestingly, in Sweden, because it's socialized, Leif apparently had access to incredible amounts of data. And so he was able to say, okay, in the whole country of Sweden, how many people were diagnosed with chronic joint problems? So that's your 100%. Of that 100%, how many were able to get into one of my 800 clinics? And that was only about 20%. So even having 800 clinics, over 1,000 physical therapists, the feeling was there was a very low utilization of this program. So 80% of the people didn't go. Now in Sweden, it's not from a cost perspective, but it would probably be more from a convenience perspective. Childcare, work, parent care. So people were not able to get in their cars and go to a clinic. So the second funny part of the story is that the son of the founder, so Leif's son was in computer science, and Leif's son Jacob came to him and said, "Dad, what are you working on?" And Leif told him about the Joint Academy program and the problem, or the clinical program, and the problem with utilization. They weren't getting enough people into the program. And so when Jacob looked over his shoulder, he said, well, Dad, I could digitize that entire program, and rather than people having to get in their cars and drive to a clinic, we can take to the clinic to the people via an app on the phone. So the father said, okay, we'll prove it. Let's take 300 people, we'll put them in the clinical program. You build your little widget, and we'll put 300 people in your digital program, and we'll see what happens. And so they did a side-by-side comparison looking at pain scores and just general outcomes. And the consensus of that was people actually on the platform, on the digital platform, maybe got a little bit better. And so they took that information, they took that knowledge, and they brought it to the Swedish government and said, hey, wait a minute, and rather than, this is a much more cost-effective way at getting to a larger audience. So now the program is recognized in the Swedish market as a viable destination for people that have chronic joint problems. So, and I joined them about 2.5 years ago, trying to bring the same technology, the same idea to the United States market. And we were, talking to health plans, health systems, insurance plans, Medicare Advantage. Medicare itself didn't even recognize digital options in any way until COVID hit. So in the past 2.5 weeks, I've had more intense conversations with people about this solution. And again, it's pretty obvious why this is a good solution. The population that has chronic joint pains, or in general, the population is aging. And these are populations that are not going to clinics, the doctor's offices or physical therapy clinics. And so the need for a digital solution exists. Problem being, some of the clinics don't know how to do a couple of different things from a clinical perspective. They really don't have a standardized treatment approach that Leif developed. I call that the secret sauce. So Leif came up with the kind of the pathway. So think of the protocol on how to treat these patients. So some facilities, each facility treats sort of differently, and each facility might treat using their own unique approach to chronic joint problems. So those facilities are going to have a very hard time taking that uniqueness to a digitized program. So that's the first problem. Second problem is they don't have the technology. So they haven't, I have a clinic in Northern California still, and we're wondering, what technology are we going to use? Are we going to use Skype? Are we going to use Zoom? What about our documentation? So it's really, the opportunity exists for clinics to now start to use technology to reach out to their patients, but I'm not sure we know what technology to use. And then from a scalability perspective, the old mindset was, I work in my neighborhood and I work in network. So I'm in Marin County, which is north of San Francisco. The assumption was I'm going to get patients that are in my little neighborhood. So we never thought that way. When Joint Academy was developed in Sweden, they were thinking the entire country of Sweden. They weren't just thinking one county within Sweden. So with I think with the COVID crisis, people not going to clinics, the physical therapy center is not really prepared to deliver it telephonically or through any digital means. I think this is a wonderful opportunity for a company like Joint Academy to fill that void. So the Joint Academy digitized program, just like the clinical program, we had significant pain score results, significant improvement in physical function, significant reduction in medication use. So that's, I think, really important too from the opioid consideration. And there were lower downstream costs. One good thing about the digital they found in Sweden was there was higher utilization. So there was no barrier to entry, especially in a system where there are, it's a socialized system, so there aren't the typical copays and deductibles that we face in the United States. So it was really an access issue, and by taking it to the people via an app, it increased the utilization. So there was an increased adoption of the technology. So I have a quick demonstration of the product itself, and I'll talk over that. And then there's a demonstration, a quick demonstration of a physical therapist working on the platform. So just like going to an office, first of all, you download the app, you go into an office, you put your zip code. By entering your zip code, you're matched with a physical therapist that lives in your state. So just like, well, it's actually changed since COVID a little bit, I think. But right now we're following practice laws, filling out the same paperwork, the HIPAA paperwork. Welcome to Joint Academy. So if you were sitting in my lobby filling out my questionnaire, same idea, basically. You're filling out all the information, all the pertinent information about yourself. At some point in time, you're randomly matched with a physical therapist. That's your physical therapist for the entire journey. You set an appointment for that first virtual visit. We do have the ability to check benefits. So that's always a question that comes up from a patient perspective of, is my insurance going to cover this? So we do have the ability live, if a patient enters their insurance information, it will automatically verify that they're covered by either a self-insured company or by an insurance company. The physical function test, I was on a call earlier today and they were saying, well, what are you looking at? So this physical function test is a sit to stand test, which is a mini squat. And this is a validated test. So someone that improves in their physical function, someone that improves in their sit to stand ability or the mini squat ability is an improvement in their life, in their physical function, their fitness, their health. And you get a call from, that's me, there's a physical therapist setting up that first phone call or video session, depends on the patient's technology. Just like at my first physical therapy session, I set goals. So one of the goals we set is a pain goal and a physical function goal. Next is, we gather other health data. We're constantly going back and looking at data to see what's important, what gets us the best results. So there's a lot of health data that we gather along the way. Education, so there was research that said if you educate your patients, they'll make wiser decisions. They'll be smart consumers. A little gamification with quizzes. And this is an example of the exercises that we send out. So patients get about 5 minutes a day of either exercise, education, or data tracking. So pretty high.
Sorry for interjecting. Are you showing us a video? Because all we're seeing is this white screen.
Yeah, I was showing videos. Maybe the videos don't come through.
Sadly, no. So yeah. You might want to describe just what might happen because we don't see the video.
So it's an app on the phone. So so just like an app, any other app, if you were booking a Dine Dash or something like that. So an app on the phone, like you can see on the right. You can see my screen now. Are you still able to see my screen?
Sorry, yes, I was.
Yeah, so the right-hand side is an example of the patient's view from the app. The left-hand side would be the physical therapist's view of the app. So basically, it's better for a physical therapist working on their computer because we built basically an EMR. So that EMR allows the therapist to work remotely with the patient, but the patient's working on an app. And so the patient has push notifications coming through on the app where they have new assignments or new questions to answer or pain scores. And they can also message their physical therapist from the app. So it's a two-way communication portal. And they have access to their physical therapist almost every day in some cases. So we have scheduled events, and then there's also access to the physical therapist throughout time. And so I think that's, one of the questions that comes up is, well, why do you think patients got better results working remotely than they would if they went to a clinic? And my answer always is, when patients go to a clinic, I get to see them maybe twice a week for 40 minutes. I don't know what's going on between the time I see them and when they go home. I'm not sure if they take my exercises and pin them to the refrigerator. I don't know if they're doing them. I don't know if they're sore doing them, if they're doing well. With the app, they're able to reach out to me, and I'm also able to open the app and look and see if they've engaged with my exercises that day, or opened up my messaging that day, or done my data tracking that day. So I think the ability to reach out to a patient on a regular basis, kind of that nudge philosophy, is one reason why the technology might be better, get better outcomes than the clinical program did. And that's roughly sorry, my videos didn't work because the videos are pretty interesting to look at. People seem to like to see how it works. But that's kind of an overview of the Joint Academy program. And I'm going to open it up for questions.
Sorry, I may have found a way to share that with us. Okay, so just give me a second. I've been working in the background to see if I can share that with you. Let's go ahead and close out your video. And let me see if I can share the Joint Academy video. Okay.
So that's the therapist view of the platform. So again, we've essentially built an EMR for the physical therapist to work. So when I open up my dashboard, I can see if I have any new calls to schedule or videos to schedule. I can see if someone's messaged me. I can open up a patient's chart and I can see if the patient's been opening my emails and doing the exercises. So that's the physical therapist facing side of the technology. And then the other video was more the patient facing side of the technology.
Okay, I'm gonna go ahead and change that view now, and give me a second because I'm not super fast on this thing, but that's the video you were trying to show, right?
That was and the other one was more the patient working on the app. So the app is pretty interesting.
Let me see if I can show that. Let me close this out, and I'm going to bring up that session there. Patient journey, share, and let me just make that larger.
Yeah.
Boom.
So again, I think just think about someone signing up at an office. So as they enter an office, rather than being in the office filling out their paperwork, they're just doing the paperwork filling out via an app on their phone. So they download the app, and when they start entering their zip code, blah, blah, we start to match them up. So again, just filling out the basic demographics their patient would fill out when they went to an office.
So they're asking questions and they're working the way through. Just and once this is done, this goes into the system. Terrific.
Yeah.
Yeah. So it's an intake health questionnaire, and this information goes into. So you built sort of an EMR in the background of this.
On the other end, so the physical therapist then will open up their version of the dashboard, and in that is where it's an EMR basically, where the therapist will do all their notations and all of their record keeping.
So the system actually goes and checks the insurance information is simply your insurance name and your number.
Correct.
And that's all that's necessary. And the system can go check, and they can be told exactly what their copays are.
Correct.
What have you. Terrific. Okay. Yeah. And you said that a physical therapist is randomly assigned. Are you able to select your own therapist or look through a list of ratings for therapists?
We actually do rate our therapists, and we start to skew towards the therapists that are getting the higher ratings as far as patient-reported scores and timeliness. I think what we're going to come up against is some health systems might want to use their own physical therapist, so they might want to be a closed system. So right now it's randomly matched, and we are trying to match them with therapists that are getting better outcomes or who are performing better on the platform. But I think what we're eventually going to end up doing is a health system might say, listen, our physical therapists, we want them to be clinical, but we'd also like them to be digital. So we'd like them to be doing two things. So just use our closed system, like a Kaiser. Right,
exactly. So, okay. Is this the video is still going, or are we done with it?
Just the exercise, if you could just show the next part of it is interesting to show because it shows what the video looks like of the exercises that they'll do.
So I can see a series of questions here. This is a knee therapy exercise primarily, and what I'm seeing here is that this is a video of an exercise.
Correct.
And this is a real person doing them. I've seen these as avatars as well, and both are viable options. Super. And so that was a self-rating. The patient was rating their results.
Correct. And I always say we have AI and RI. So we have artificial intelligence and real intelligence on our platform. And the artificial is the machine will listen. So if I say that was too hard, the machine will listen and make it less challenging next time. And as a physical therapist, I could have talked to the patient and the patient said, no, I clicked the wrong box. I can make it harder again next time. So we have the real intelligence and the artificial intelligence. I'm not sure which is which, but.
Got it. Okay, terrific. So we'll get a chance to see both videos. Woohoo, we managed to make that work. That's excellent. Okay, so I have a couple of questions myself. I have certain questions here in the audience. So let's start with the audience questions, and I encourage anybody to go ahead and upvote or downvote these questions. I think we may have lost Rich a little bit. He'll join us again real soon. Rich, can you hear us still?
I got you. You got me still? Yeah, I can see you and I can hear you.
Yeah, it's the video that lost us a little bit, but it'll come back in just a minute as the platform catches up. Okay, there appears to be evidence that for some pain, behavioral health problems are part of the root cause. To what extent are mental health interventions such as cognitive behavioral therapy part of the secret sauce that Leif developed? And this is from Christoph Dankert.
Yeah, I think, and then we get that question a lot. And I think that, clinically physical therapists we're not cognitive therapists, so I would never claim that we are, but basically that's part of what we're trained to do as PhD level physical therapists now is behavioral change. So I think that rather than having two people on the platform, one that does behavioral change and one that does exercise instruction, the assumption is that you have both in a physical therapist. So part of what we do as physical therapists, I'm a physical therapist by training, is try and change people's habits so they become lifelong exercisers. So rather than having a behavioral change specialist and a physical therapist, we just baked it into one.
You baked one. But you do know that in some cases, maybe a trained behavioral therapist may be helpful.
I think that's a problem. Yeah. And there's comorbidities too. So you have to talk, addiction. So if you're talking about somebody that has an opioid addiction, I say do exercise and you'll stop taking opioids. It's much more than that. We realize that.
Yeah. Mike Ryan's asking, how many patients are currently using Joint Academy apps in the United States? And then while you're at it, tell us about Europe and maybe a little bit of a geographic distribution. And then question about age issues around adoption. We've definitely had that question come up frequently in the context of the symposium, of this summit. These are technologies. Do older folks really adopt them?
Yeah, so digital native versus digital tourist or digital, so the digital natives. So I think as time passes, more people are going to be accustomed to using technology, number one. Number two, my mother's 95 and she's in a skilled nursing facility, more of a residential facility. And as soon as COVID hit, she got my brother to get her a smartphone because she realized she needed to start. I think she saw the invention of the phone and now she's getting a smartphone. So I think, so it's about 15,000 people on the platform right now, 15,000 users, and it's going up. They're breaking records, obviously, in Sweden. The biggest problem in the United States was we did a soft launch in the United States, and we did a free trial to people. And everyone, as we all know in the medical profession, asked about, will my insurance cover this? So it really, everyone gets very skittish about, number one, pulling out their credit card and paying cash, and also feeling like, that my insurance should cover this. So we've really been working hard to try and get in front of the insurance plans and have them recognize this.
If you look at to go a little deeper in that same question, though, that Mike asked, do you have statistics on the percentage of patients that are using your platform by age group? I mean, arthritis is by definition older person's disease. So my assumption is that the bulk of your patients are well over 60.
Yeah, Walmart has 11 centers of excellence for joint replacements that they send their employees to. And so Walmart's got a joint replacement problem. Walmart's got an osteoarthritis problem, right? And so part of the self-insured industries now, we're starting to see that Boeing, for example, has a center of excellence program as well. So it's a problem, I think, that's trickling down into the working force. I've had as much traction in the last year and a half from self-insured companies as I have from Medicare Advantage plans.
The question coming from John Macy is this something you suggest using independent of traditional physical therapy, in partnership with traditional therapy, or is it a mix?
So the question of store forward, in other words, I started in a clinic and then I'm just working remotely, or 100%, this is 100%, this is more like a teledoc. So this is 100% telemedicine product. So it's not associated with a clinic right now. Will it morph? Will it eventually be something where it's run through a clinic? That's possible, but right now it's a pure play telemedicine product.
There's a question over the comments by Rashma Anath asking about how a patient will, is this a way for us to manage patients during their arthritic process until they're ready for surgery, do you think? There's also some data, and I know we've spoken about this, that there is a subset of patients who potentially with the appropriate physical therapy could just simply avoid it.
I think you'll see a third, a third, a third. So a third of the people will do well and probably fall out of the queue. A third of the people will stay in and work and maybe will trickle into surgery. And a third won't do well and will go right on to surgery. But it is a filtering tool, number one. And number two, when you talk to any other industry and they say, and Dr. Bini, you're a joint replacement doctor, you know, when you say no to someone, no, you don't need a joint replacement, go home and call me when you want one, is not very good patient management. So you could say, you're not a candidate yet, but I want to put you in this conservative program, and they might guide you back to me if you don't do well or if your status changes. But it's a good management tool. It's a good patient management tool versus no, call me when you want a joint replacement. Right.
The patient at home with arthritis, is this something they can go online and they can't go to the house? It's COVID time. They're injured, they're sick, or they just want to stay healthy. Can they go online and prescribe themselves a physical therapy program? Does it have to go through an insurer or some other platform? Is this a B2C or a B2B platform?
You know, I think it's going to be a B2B2C. I don't think it's a direct to consumer because, again, the consumer, as we all know, would prefer to use their insurance plan. So that it's, and even when we said it was free, we had a hard time bringing people onto it for a free trial. So I think what you'll see is, and we are working with a couple of health plans in the United States and doing what's called co-branded outreach. So your health plan wants you to participate in this program. And I think that's going to be where people are going to feel more comfortable getting onto it. So I don't think it's a direct-to-consumer product. I just think that people in the United States are used to using their health insurance to pay for
it. Another question that comes up is, can physical therapists join Academy and bring their patient population with them, or is this something that is not open?
No, it's a marketplace. So you know, the goal is to work with physical therapists, and I think, did you guys lose me? I just lost Dr. Bini.
No, we're good. I've got you.
You are your symbol now.
That's some interesting ideas there, but
right. Yeah. So
keep going. I can hear you.
Yeah, the goal is to bring therapists onto the platform, and then we can generate business for them. Or if they bring, we incentivize them if they'll bring their own business onto the platform. So we'll give them incentives if they invite somebody onto the platform who stays in the platform, we'll bonus them. But typically we'll also drive patients their way. So both. It's a marketplace in that regard.
Let's see. Oh, you mentioned, I think in your opening remarks, you seem there was an up to fill void being the lack of adequate remote physical therapy. There's certainly other companies out there. There's Recovery One. There's I think Ready Surgery. We're going to hear in a minute from Force Therapeutics. But it sounded more like, you know, as a replacement for PT, and I think we sort of addressed this question again, but I want to rephrase it. This is an adjunct. This is a tool that we can use, particularly for patients who are distant from a therapist, who don't have time to come into therapy, because that takes a lot of time. They may not be retired and just don't have the time. It's an adjunct. We say that these technologies are really designed to help our patients and our clinicians. And in the context of COVID, of course, if we can expand access to it, even better.
It's a referral option. It's a digital referral option in a sense. In other words, you know, you can go to, and I think that the statistics say that of the prescriptions that the physicians write for medication, or the prescriptions that are written for physical therapy, under 20% of the people fill those prescriptions for physical therapy. And for whatever reason, whether they can't go or they don't want to go, or the copays or the deductibles, and so this increases access. So you know, people can go to this whether they have children or they have jobs. They could do it at their work. So I think that it is a means of access. And yes, with COVID, I think also you don't want people on the roads. You don't want people. So it's a digital option. You're right. It's a referral option. You can go clinical or you can go digital.
So one last question. As you talk to insurers, have you found, let's just say that an insurance company says, okay, you can have this shoulder replacement procedure. After this, we're going to allow 10 physical therapy visits total. After that, it's your payment benefits go away. Does this count as a PT visit? Does that count as one of those 10 visits?
Yeah, yes. And the ones we've talked to, that's what they're saying. They're saying this will go towards their visit count. I think what the smarter plans are starting to realize is that with technology, things should be cheaper. I had a patient who used to say cheaper, better, faster, cheaper, better, faster. That's how the Silicon Valley thinks, is cheaper, better, faster. So if we can do it cheaper, better, and faster, then a lot of those restrictions should go away. We don't need to be policed with 10 visits because we trust that you're going to do, outcome visits, number one, but also cost-effective visits.
Yeah, it's something that definitely the various associations can get together and support you on. I think this idea that the virtual visit should count against your 10 in-person visits really is problematic. And I think something that we need to lobby and discuss more vocally.
I mean, interesting, they are saying to some patients, we'll waive your copay and deductible if you'll go to a cheaper alternative. So if you go to a clinic, I know the clinic fees, these guys are able to do it cheaper because they're digital, they don't have overhead, they don't have reception and brick and mortar. So a lot of cases, they might be driving people saying, listen, if you go through the digital means, there's no copay and deductible. If you go to a clinic, you're exposed to copay and deductible, which is interesting.
But in some situations, I think that in-person physical therapy still has a lot of value. Maybe not every single patient, but for some, it's critical. And so but they can only be done twice. See, this is my job to fill in. That's the void I was thinking of filling in. Is like that we can have 7-day-a-week physical therapy with those 2 key visits. There's some joints that really don't respond. I mean, the shoulder is very difficult. The hand, very difficult to rehabilitate. And hip, which is what I work on, is I think, frankly, easier to manage using a virtual platform than some of these other injuries or surgeries. So it would be fantastic to have both. Now, in the last few minutes, I'm wondering, what are your thoughts about how do we make this more accessible in the context of COVID? Is there something that Joint Academy is doing in Europe to open up to a more B2C model just for if nothing else, to keep people healthy in their home?
I think Medicare has ripped the lid off of this with COVID. Medicare has basically said, bring us whatever you want to bring. We need to do stuff like this. We realize now that we need to do this stuff. So we weren't able to talk to Medicare 15 days ago, and now they're basically saying, please bring us solutions, because we realize that we can't put these people at risk. We can't put patients at risk, employees at risk. So I think that this COVID might have ripped the lid off of a lot of things. That we're slow to move towards. So again, just make it an option. When the dust settles and we're allowed to go back to clinics, maybe people will say, I prefer not to go to a clinic. I prefer to do this remotely. So I think it's changed. It's changed. It's going to be interesting to see if we go back, or how we go back, what we go back to. Will we go back to?
I'll continue that thought. And I was agreeing with you.
No. I think I saw a research paper that said every time we go to the doctor, it costs us $42 in time, gas. So if we're able to do some things, not everything. I agree. So probably gonna have to go see your physical therapist. That's that store forward concept, and I like the store forward concept, which would be come see me once, and then go away and see me again in a month. In the meantime, I'll work with you remotely. And if you're struggling, I'll pull you back in, or you can drop back in. So I think that store forward concept is something that like you were saying, kind of a combination of the two. I still have access to the clinic, and it allows you to expand your reach too. So if someone says, I just can't get to your clinic, you're a specialist, you do a great program, I can't get to you because it's a 45-minute drive. Well, come once, and then the rest we'll do remotely. So I think it's gonna, this is gonna change the way the world treats people, or at least the United States.
In the Bay Area, it's a 45-minute drive and it's a 2-mile distance.
Yep. Go down to LA. Check on LA. Everything's a 45-minute drive in LA, or an hour drive.
The value, the cost to society, cost to the patient is never counted in these things.
Yep.
So in summary, the last thing I said is, do you tell me about how you say you have some AI and your AR, but the idea being that the software is tracking how the patient's doing, because a lot of physical therapists, providers, doctors in general, you know, it's great to collect this data, but we don't really have the time or the knowledge to manage all these data points. I presume that it's taking that information, scanning and screening it, and there's an engine behind that that's saying, well, these 3 patients need your attention. This seem to be either not engaging. Talk about it a little bit.
Yeah, so I think that's the filter. So basically, you know, and what Leif was able to do by looking at such a large population of 200,000 people is he asked lots of questions coming in and lots of questions going out, and he boiled it down to what's important. So, for example, BMI wasn't important. Loss of BMI versus exercise wasn't important, so it's not emphasized as much. You know, the shaming of losing weight versus, hey, just move, just exercise. The movement was so much more valuable. So I think he boiled down to what is significant: pain scores, physical function scores, desire for surgery is another data point that he likes to talk about, and the other pain medication. So you know, if you're looking at someone and their pain scores are going up, their pain is getting worse, and their physical function is going down, and you keep working with them, then those are the people that will fall into that 1/3 funnel that will probably be guided towards a surgeon. So if you took 100% of your patient population, said go into this funnel, over the course of 6 weeks, I could tell you who's coming back to you and when. I could say this population's coming soon. This next population is holding steady. These guys are doing real well. I really shouldn't bog your clinical schedule down. You know, they should stay far away. So I think it's going to be a filter. It's going to be a surgical filtering tool.
Excuse me. There are questions come up about cost of these services. I presume that varies a great deal, and it's based on the purchaser that then makes it available, right? Because mostly it's free. At the end user doesn't pay for this, right? This is a B2B model, so the Walgreens of the world, the Kaiser would bring a platform like yours on board. But then the patient sees it as a benefit. Is that right? With maybe a copay? How does that work?
Yeah. So you know, it depends. It's a case, but you know, the one thing I've heard about, if you've seen one deal, you've seen one deal, right? So as you talk to a health plan in Sweden, you know, you could be in a pharmacy. It's covered 100% in Sweden. And if you'd be in a pharmacy and you could see a kiosk and you could sign yourself up in a kiosk and you know, away you go. So they've advanced a little bit further along now in Sweden, but I think in the United States, my sales to the health plans are make this easy for people, eliminate the barriers, because it is more cost effective to do it this way. And utilization might be higher. So in other words, if only 20% of your referrals are going to physical therapy or for medication for that matter, I think the statistics are incredible about people fill their prescriptions. So if patients are actually following the doctor's orders, is that worth the insurance company to pay the full freight?
So real quick, let's go to Sweden for a second. So now you're saying that you walk into a pharmacy to pick up your Tylenol, and there's a kiosk, and you can sign up for this program. Quick questions. Well, are there programs offered? Does the government cover a number of options, or they just this is the one?
I think it just so happened that Leif created the clinical program. It just so happened that Jacob was 30 for 30 European. Inc. Magazine, 30 under 30 Europe, and so there's not a lot of technological companies doing this in Sweden. I think other European countries are having other digital healthcare companies launch, but Sweden, there's I think there's just a Teladoc coming on, Swedish Teladoc, but this was the first telemedicine company to really launch in Sweden.
Outstanding. And what a great adoption. Let's give Leif a shout out. He's done an amazing job of not only conceiving of a program that's clinically effective. And one of the take-home messages here also, this is not just, hey, this is a random set of exercises you put online. You don't just put, oh, your choice, this exercise, that exercise. This is a pattern, much as one would with an athletic training program where you're trying to train for a marathon. There's a series of steps that build on each other until you now have, you get to an outcome. And so it's not just random PT, it's a specific program that has been documented over a 30-year time frame to get a patient from A to B, being a better state, or potentially, because even if they come to total knee replacement, for example, in my case, heck, that's a much better patient for me to operate on than someone who hasn't exercised in a few months. Or
I could tell you this one's going to be a harder risk because they're just not doing well. They're really struggling. You know, another thing I like to say is that we're not a tech company that came up with technology and tried to shove it down into healthcare and figure out where we slot. We're a healthcare company that grew out of clinics and started to use technology to expand. So I think it's the opposite of what you'll sometimes see, which is, hey, this is cool technology. Well, how do we make this work in healthcare? Versus, hey, we need technology to help with this healthcare program.
Outstanding discussion. I really love the way we finished this out. We're going to go on to hear more from a US-based company called Force Therapeutics that's following up. This is the end of the 11th session with Rich Waldron from Joint Academy. And thank you for participating. And it's been a really extraordinary session. I really enjoyed it. Thank you very much, Rich.
Great job, Dr. Beeney. Keep going. I know you're tired, but keep pushing through. Keep pushing through.
Bye now.
See you later.